Farmer Klein.
Yeah. Oh no, there's gonna be a thing of like a farmer on my head. Yeah. Welcome back to DocTalk. It is January. We're back in 2025. DocTalk, as you all know, is the show where me, talk to a doc about what we know you want to talk about. And this is Dr. Janet Choi. I'm Lissa Klein. And today, I'm really excited about this episode. We are going to be talking to a doc from the point of view of a newly pregnant person.
It's a moment to celebrate because we've been talking about infertility for so much. So why don't we kind of flip it and talk
start the new year and talk about a new pregnancy.
Exactly.
And so we know that for people who are newly pregnant, there's a lot of questions that come up. Can I take Advil?
No.
We'll get to that. What if I eat something bad? How do I manage my stress? Like all of these sort of anxiety-provoking questions. And so hopefully we can answer some of these questions for you. If you're newly pregnant or thinking about getting pregnant, this is a really good episode. Hopefully we put your mind at ease. We know that if you are pregnant or trying to get pregnant, for that matter, you shouldn't pick up an old vice like smoking.
No, please don't.
Please don't. And let's check in on some of the lifestyle choices that are particularly bad or contraindicated for pregnancy. So none of this is true. I typically use cigarettes or I vape. Can I do that if I'm newly pregnant? No. Why is that?
It is not only a cause for oral and lung cancer, but it vasoconstricts and you want all this great blood flow to your growing pregnancy. And it's just not good all around.
Yeah.
So just, if you've been toying with the idea of quitting, now is a great time. If not for yourself, for that pregnancy that's growing inside of you.
Yeah. Vasoconstricts means it makes your blood vessel small and the blood isn't getting to the baby where it needs to be getting. Yeah. What about alcohol?
No. However, oftentimes you may not know that you're newly pregnant until you're a few weeks in, and so it's not uncommon for a patient to call freaked out because they're like, I just found out that I'm 8 weeks pregnant, I'm really thrilled, but I had a glass of wine a week ago, and I'll say there's nothing to do there, you are okay, but now that you know, if you know you are pregnant, do not consume alcohol. Unfortunately, there's this condition called fetal alcohol syndrome, and you just don't want that to happen to your much-wanted pregnancy. So cut it out, and then you can plan on a celebratory glass of champagne after you deliver.
Good advice. I won't say who, but a friend of ours, I'll tell you after, went to a Fish concert and then the next day found out she was pregnant. So many of these things on the list happened.
It's okay to go to a Fish concert and secondhand smoke, things like that. It is what it is.
Yes.
Right.
Okay, next one. Speaking of fish, no, just kidding. Cannabis, THC, it is legal in many states in the U.S. People use it for sleep aids and other things like that, or recreationally. If I'm pregnant, can I use cannabis? No. Correct.
Just call me Dr. No for all these questions right now, at this moment.
Dr. No. What about caffeine? I drink green tea every day in real life. If I'm pregnant, can I have caffeine?
Ideally, you can in small doses, although there have been some studies in the past associating high caffeine intake with potential pregnancy loss and maybe even fertility issues. So I try to encourage patients to cut back at least. I can sympathize. I'm a huge caffeine addict. I love my morning cup of espresso and coffee, but at least try to curb it back. And if you're having some struggles in terms of figuring out how to kind of, get your dose of caffeine and yet not, worry about your pregnancy, talk to your doctor, your nurse midwife. Some people will find that their taste buds change and they totally get off the caffeine because they don't want it anymore. Some people will try to wean off by doing half-caff drinks, right? And instead of if you go to Starbucks every morning before work, instead of a grande, try to get to a tall half-caff and then maybe try to toss part of it and stuff. So.
Yeah, I like that. Over-the-counter cold medicine like Tylenol, NSAIDs, or Advil, things like that, allergy medication, pain medication, what about those if I'm newly pregnant?
So frequently used over-the-counter pain medicine like acetaminophen / Tylenol, actually okay to use and recommend doses as needed for the headache or muscle aches or things like that, even during pregnancy. Non-steroidals so it's a different category of pain relief medicine, traditional names include things like Advil, ibuprofen, Excedrin, naproxen, Aleve, you want to try to stay away from while you're pregnant. Now again, if it's the early stages of pregnancy and you accidentally popped one and you didn't even know you were pregnant a week ago, don't panic. But again, you shouldn't be taking them during pregnancy. cold medicine, allergy medicine. There are some that are considered appropriate to take as needed during pregnancy and some that you should not. And there's a whole list. It's going to be too boring for me to go through right now. So just ask your obstetrician. They're used to getting these questions.
Yep. Sometimes your OB will give you like a list of here's all the things you should avoid and things that are safe.
Yep.
And so if that's helpful, ask for
And
that.
if you can't wait to talk to your doctor, you can go to ACOG, the American College of OBs, GYN Society. They have a list section for patient education, and I'm pretty sure they have a list of medicines that are okay to take in pregnancy as needed.
Yeah. Moving on to the next topic, which is exercise. If I'm newly pregnant and I like high intensity, I don't actually, but let's say I do CrossFit, can I continue CrossFit or things that are like that while I'm newly pregnant?
So it depends, right? So if you actually aren't having any trouble with your pregnancy, no bleeding, no cramping issues, no pain, you're breathing fine and everything, I think it's actually reasonable to continue, especially in the first trimester and second trimester. However, if symptoms arise associated with pregnancy, like, pelvic uterine cramping, chest pain, new onset headaches, bleeding, leaking fluid vaginally, you need to pause that. You don't need to freak out, but you should first have a discussion with your provider just to see what's appropriate for exercise for you.
So can you, Dr. Choi, tell us what are like the most common do avoid or do not eat or drink these things when you're newly pregnant?
So I think we're all fairly well aware, but it bears being repeated on unpasteurized dairy products and cheeses. Pasteurized cheeses are okay. You just don't want to get exposed to certain bacteria that could cause bad infection and potentially pregnancy loss, potentially deli meats. But again, if you happen to eat a salami sandwich a week ago and because you didn't know you're pregnant, don't worry about it. Raw fish, sushi, again, we're worried about things like parasitic infections that might be in there lurking that could affect you and the pregnancy. As we said over and over again, no alcohol.
And then cheese, unpasteurized cheese and dairy.
Cheese. Oh, and then also, if you are a big pescatarian and you love your fish, make sure you go there. There's an FDA guideline site in terms of high mercury content fish because you want to make sure you're reducing the mercury intake that you're during your pregnancy, especially.
Yep, I like that. So let's talk about the do list. So what should you be eating? What should your diet look like? Should it look different when you're pregnant, newly pregnant, and throughout the pregnancy?
So a question that actually I'll answer in a roundabout way that I get asked a lot, especially for a lot of first trimester pregnant patients who are having hyperemesis gravidarum, so they're getting morning sickness, right?
Really severe morning sickness.
Right, and it can happen actually in the morning, in the afternoon, at night. For me, I had actually afternoon sickness, not morning sickness. And they're also really stressed because they're like, I feel like I'm starving my pregnancy. This is bad for them? The answer is no. You don't need that many extra calories, especially in the first trimester. So if you can't really stomach, the usual healthy diet that is your goal during pregnancy, that is okay. Give yourself some grace. If you need to nibble on crackers or things that don't make you want to barf each time, that's really important for your own sanity's sake and just for your own health's sake, and also to stay really well hydrated without puking it up all the time. You want to try to eat healthy if you are so inclined. So healthy vegetables, healthy fruits, some kind of lean animal protein to keep yourself healthy as well as your pregnancy healthy. The occasional egg if you can, because it has that choline for the fetal brain development.
Yeah. So healthy carbohydrates, so whole grains are really good. They also usually have fiber, which can help. Good protein, like Dr. Choi mentioned. Fats are okay, healthy fats like avocados and things that give you good fats. So I like to say have your food have as few steps from the ground or the farm to your plate, and that's generally a good.
That's a really good recommendation.
That's a really good recommendation.
Oh.
Yeah. So
Farmer Klein.
Oh no, there's gonna be a thing of a farmer on my head. Yeah. It's fine. I'm into it. Yeah. So think about how your food gets from the ground or from the farm to your plate, and the least steps in between that make it the healthiest, right?
Exactly.
Dr. Choi and I, true or false, we have dinner together quite often, and we eat fries when we have dinner. And so also don't be so stressed that you have to eat healthy all of the time. I think for some people that sets them up for failure.
Yeah.
So if you want some fries once in a while, if that's what you can stomach, that's okay. Just try to have most of your diet be healthy and nutritious.
Right. And actually another tip for those who are feeling really queasy right now, just even thinking about it, is smaller healthy meals and smaller portions.
Yeah.
maybe like 1 or 2 fries before you feel kind of queasy, right? That actually doesn't make you feel overfull and more inclined to want to vomit again.
Yeah. One of my friends I don't know if she had hyperemesis gravidarum or the really severe morning sickness, but she was pretty sick, and she found that like stoned fruit from the fridge helped that cold sensation.
Interesting.
And that's healthy too, right?
It's highly
Good
variable.
vitamins.
Like I've had some people who like those ginger drops when they were really nauseated, or lemon, and other people were like, those don't really help. For me, it was like tomatoes. It was weird.
It helped or hurt?
It helped, actually. I was
interesting.
eating cherry tomatoes all the time. Yeah.
Weird. Okay, so let's say I'm newly pregnant, and I accidentally just had a salami sandwich with unpasteurized cheese and a glass of wine. No, I didn't. But let's say like I ate something off the no list. What do I do?
Don't panic. And don't worry about the pregnancy. It just wouldn't make it a regular habit.
Yeah.
Not that I'm encouraging you to run out and have a salami sandwich with unpasteurized cheese and a glass of wine in the middle of your pregnancy when you know you're pregnant. However, if you slip up, that is okay. Give yourself a lot of grace.
Yes.
And then just move on with your life.
Yes. Don't let it ruin your day or your life.
Don't follow it up with a shot of vodka or tequila because you're so upset. No, don't.
Yes,
Right.
yes. Moving on, this is sort of related to diet. This is the conversation around supplements.
Yes.
So when I am newly pregnant, what is recommended?
We always tell patients this, even when they're like even thinking about trying to get pregnant, you're pregnant, is make sure you're getting a folic acid supplement. And the easiest way to make sure you're doing that is just take a prenatal vitamin. That way you know you have all the essential nutrients in that supplement. Again, not a food replacement, but an enhancement with the right amount of folic acid and the other vitamins. You're not overdoing it with a mega adult vitamin. And the folic acid is really important. It's been shown in many studies to help decrease the risk of you having a baby with a spinal cord defect. So why wouldn't you want to take it?
I'll say on the folic acid one too, we see a lot of controversy or like influencers, people online saying this folic acid is right and not that folic acid.
Oh, methyl tetra.
Yeah. Take the one that your
acid.
OBGYN recommends.
Yeah.
And as we've said before, take your advice from medical professionals and not people online.
Exactly. Because a lot of people develop anemia during pregnancy, especially in the second, third trimester. Your provider might talk to you about taking iron. A lot of people initially find it very constipating, so I usually tell people early in pregnancy if that's an issue, you can drop the iron part at least for the first month or two, and then talk to your doctor again once they check your lab work.
Check that the prenatal you're taking includes all the things your doctor's recommending. Yeah.
So really those are the key things. Now with that said, there are also prenatals that have a little bit of fish oil for presumed improved fetal brain development. It hasn't been really proven, we don't know, but it's reasonable to take again in a prenatal vitamin. Magnesium also might actually also help with your bowel function and your sleep, so it doesn't hurt. Again, packaged in a prenatal vitamin. And we talked about things like, I don't know if I would necessarily take a ginger supplement, but like ginger candies and chews if you're feeling a little queasy, doesn't hurt as well.
Or ginger like steeped in water, like a ginger tea.
Like a ginger tea, ginger ale.
Yeah,
right?
yeah. And if you have Progyny and you have access to our Pregnancy and Postpartum program, you also can talk to your PPC or your nurse who you're matched with, and they can help go over some of this stuff too.
They're a fantastic resource, and they're available to you. And same with our preconception team as you're thinking about pregnancy too.
That's true. Okay, moving on to one of my favorite topics, a little biased, being an LCSW, stress and mental health. And so many movies and things in like media show a pregnant person and they're like super stressed, and there's a climactic scene that forces that person into labor, like something dramatic happens.
Right.
So I have some questions about that. Can stress really affect your pregnancy outcomes?
You mean like your mother-in-law showing up, surprise, from across the country, and you just don't get along with her? No, they don't really affect pregnancy outcomes.
Yeah.
Like if we're talking about a stressful job, a stressful boss, that kind of situation. So another question some people will ask is, because it took me so much time to get to this point of pregnancy, should I quit my job? And I'm like, no, right? That would actually be more financially stressful, I think, in certain cases. So no, stress doesn't really. With that said, mental health and well-being is super important at every point in life, but particularly during pregnancy and postpartum, because we're trying to make sure that you stay healthy also, as well as the baby. Unfortunately, maternal mortality and morbidity rates related to mental health issues are on the rise in the United States, so you need to take care of yourself.
So let's go through some ways that can boost your mental health and maybe reduce stress. So we talked about gentle movement. There's good data that shows that movement, exercise like walking, yoga, breathing, etc.
Walking in nature. I mean, it's hard in New York, but going to the park or something, right? If you're
helps.
in New York.
Yep. Positive self-talk. So I always say, if you wouldn't say something to a friend, don't say it to yourself. So sort of your internal thoughts, try to have those be as positive as possible. You're doing a really good job. Everything you're doing is right. Sort of reinforcing that in your own mind. Therapy is great. I am an LCSW, so technically I'm a trained therapist, and so I am a little biased, but I will say that having a non-biased third-party person to talk to and to help you create some compensatory strategies or create some ways to manage stress or your mental health or just your life is a really good thing. Having a person that you can talk to, a friend, your partner, or whomever is also, I think, good.
And sleep.
And sleep, yes. So we didn't talk about sleep.
Naps.
Rest and sleep.
Yeah.
Sleep is so good for your mental health, but it's really good, especially for developing baby and just your health in general. I think it's often overlooked.
It is. And sometimes it gets a little bit uncomfortable, so work on keeping your bedroom sort of sacred, keep it cool and comfortable for yourself. Some people like a little sleeping side pillow as they become more pregnant. Some people use sound machines. We talked about sleep hygiene in terms of turning off all your screens at least 30 minutes to an hour before you go to bed. All those things to try to make sure that you really get a good night's sleep. And a really important point is if all of these tips are not helping your mental health, you're just feeling like you're going to go off the rails, don't wait for it. Don't be embarrassed or shy about talking to your provider or talking to your partner about getting more professional help. There are actually situations in pregnancy when using certain prescription medicines for anxiety and depression are warranted and are safe, considering the risks and benefits. So you should not have to suffer in silence or think that you don't want to talk to a doctor because the medications may be dangerous to you in the pregnancy. There was
a study in 2018 through the CDC that showed that 1 in 5 pregnant people weren't asked by their provider about symptoms of depression and anxiety. And so, to Dr. Choi's point, if someone isn't asking you, it's okay to offer this information, like, this is how I'm feeling. They'll help you normalize it, and they'll help offer ways to manage it as well, which is important. If I conceived via IVF or IUI, is my pregnancy inherently different? Should I navigate it differently?
Not necessarily, no. Particularly if you have a singleton, meaning one pregnancy growing inside of you, that doesn't necessarily ratchet you up into a high-risk pregnancy. At the same time, you need to be very cognizant of your mental health needs and stuff like that. And so make sure you share and ask for help before it becomes a crisis situation if possible, right? If you've conceived a twin pregnancy or a triplet pregnancy during fertility treatments, congratulations, and the risk for your pregnancy for things like preterm delivery and loss increases. And so talk to your OB, your obstetrician early on. They might also have you consult with a high-risk OB as well, maternal fetal medicine, to try to keep you and those pregnancies safe.
Another really good resource that we haven't mentioned yet is doulas. So if you have the means, there and
the benefit through your
and the benefit,
employer.
Many increasingly people have coverage for doula. So a doula is a non-medical person who's been trained specifically around prenatal and postnatal care and labor and delivery as well. And they can help you manage stress. They can help you understand what to expect, which I think helps manage stress. And they can sort of be your support person in the labor room, whether that's in person or virtually, and then post-delivery at home. And there's been a lot of really good research that shows that doula care helps reduce bad outcomes and helps people feel more empowered and feel less stressed with their pregnancy.
Again, if you have that resource through your employer, definitely take advantage of it. And it's a great tool to have in addition to the other people on your care team, including your doctor and or your nurse practitioner.
So you mentioned pregnancy loss a little bit. If you've had a history of pregnancy loss in the past, regardless of the anxiety that you may have with each pregnancy, which is real, do you have to navigate that pregnancy differently if you've experienced pregnancy loss in the past?
Potentially. Depends on the history. I always think that it's worth seeing your obstetrician on the earlier side if they have the time and space, because it's such a stressful scenario, especially if you've lost more than 1 or 2 pregnancies. If you've had preterm losses, like in the second and third trimester, your doctor might have a much more scripted, scheduled series of appointments to try to make sure that it doesn't happen again.
Yep.
So it kind of depends on the scenario. But just because you miscarried in the past doesn't mean that the pregnancy you're carrying is destined to have that same fate. So
Yep.
you want to stay hopeful and optimistic.
Agreed. So it doesn't necessarily mean the pregnancy is this current pregnancy is
No,
affected,
not at all.
but it may mean the surveillance is a little different.
Exactly.
Yeah.
One other common
Tell me.
question,
Yeah.
is sex okay during pregnancy?
Oh, yes.
Right?
Is sex okay during pregnancy?
Because sometimes people are embarrassed to bring that
That's
up.
a good question.
They should not be. You should not be if you're listening. It depends. In most cases, sex is totally fine during pregnancy. Again, if you're not having those symptoms we talked about, that
Yep.
might limit your exercise.
Yep.
So if you're not having bleeding or any kind of vaginal discharge that's concerning, or pelvic cramping or pain or contractions, and if you're not at risk for preterm labor and your doctor is giving you the clear, then yes, go for it and enjoy yourself and enjoy your, either by yourself or if you have a partner, with
Yep.
your partner.
Yeah, I like that. Typically, people are recommended the 6 weeks after they deliver that sex is not allowed, or
Right.
at least penetrative
Yeah,
sex.
but during pregnancy.
Yeah.
Again, if your doctor has said there are no issues or precautions, go
Go
ahead.
for it. Here's to a healthy, happy pregnancy for you if you're
Yes.
watching and you're pregnant. As always, if you have questions that you want me to talk to a doc about, please drop them in the comments
Yeah.
and we'll do an episode about them. We love hearing from you. Until next time, stay curious, take care of yourselves. Bye.
Bye.